Everyone, lots going on, but I'm going to focus in on contact tracing because this is, well, I think Amazing Polly needs to do a deep dive on some of this stuff. I think that there is this contact tracing is not what it first appears, I think. And well, here's CTV News. This is a release from today. Prime Minister faces question: how will feds help ramp up COVID-19 testing, tracing, and contact tracing? And this caught my eye because the provinces are in charge of the testing and the provinces are in charge of contact tracing. So here we go. Prime Minister Justin Trudeau will be under pressure today to detail how the federal government will help provinces massively scale up testing for COVID-19 as the country slowly begins to come back to life. I think that their use of language here is interesting. In another article, I'm going to point out another area where, and it's from May 3rd, but they say as the social distancing measures are lifted, right? And I thought, it's May 22nd now, right? We're like 20 days past that, a couple of weeks, almost 3 weeks past this. And the social distancing measures are they're not being lifted as far as at all, really. The playgrounds are still closed. The dog parks are open, which I thought was weird. But they're not really lifting social distancing. They're saying a few more people can get together, but the use of language is weird. It's to placate, right? Like, don't worry, things are going to be back to normal soon, right? As things start to return to normal, and 3 weeks later, nothing's changed. That's a long time. That's like, imagine like how long a bathroom renovation takes, right? Like 6 weeks is a long time. 3 weeks is a long time. Okay, back to this. Trudeau reiterated Thursday evening his offer of federal help on testing and contact tracing during his weekly conference call with premiers, repeating an offer he first made a week ago and which the Prime Minister's office says was well received. Yet, despite that offer, the provinces and territories combined are testing fewer than 30,000 Canadians every day, less than half the available testing capacity that Chief Public Health Officer Theresa Tam has said should be the target. Well, I mean, there's the target and then there's the actual, right? So like, this is pretty fast to get up to that, to get up to the testing that we're doing. Ontario is doing 10,000 tests a day. BC was doing 2,500 tests a day in May 3rd, so 3 weeks ago, right? Back to the article. I scroll down. Trudeau said Thursday that he and the premiers would talk later in the day precisely about how we can scale up testing immediately in places where it's necessary, like in Ontario and Quebec, and be ready to scale up almost instantly in places where right now the virus is pretty well under control, but any flare-ups need to be responded to extremely quickly. I don't understand this. What does that mean, be responded to quickly? Does that mean like shut down the whole province? I'll show you what Guelph looks like. This is what Guelph looks like as far as cases concerned. So the city of Guelph, right, here's the data. It's from May 21st. It's up to date at 10:46 a.m. There's 135 cases, 0 newly confirmed in the past 24 hours. Resolved cases, 96. Fatal cases, 8. Self-isolating, current cases, self-isolating 14, in hospital 5, in ICU 2. So are we a hotspot? Do we need to be in phase 1 or can we be in phase 2? Who makes that decision? How quickly? Because if you're willing to admit that most of these cases are in long-term care facilities and vulnerable populations, I was looking for the word vulnerable there, vulnerable populations, then, and you can admit that these numbers look good, then why is the whole province on lockdown still? It doesn't make sense. Like, it doesn't make sense to me, right? It seems weird. The idea that you can scale up and respond to something extremely quickly, but right now we all need to stay locked down because we're all in this together. And the coronavirus, if there's one case, we're all at risk, right? Like, it is the difference of what they're saying. It doesn't coincide. It doesn't make sense together, right? Like, it in fact contradicts each other. So what is it? Is one case too many? Or, can you have places where it's not so bad and places where it's a lot worse, right? It seems like you can if you listen to the Prime Minister, but I mean, why would you do that? Back to this. Tam told the House of Commons Health Committee earlier this week that Public Health Agency of Canada has developed a roster of people available to help with contact tracing, including federal public servants. Testing and contact tracing are considered essential to prevent a second wave of COVID-19 cases by identifying and isolating those infected by the disease and the people with whom they've come in contact. Okay. This contact tracing started in 2004, and there was reports talking about using it to track SARS, hand, foot, and mouth, and a few other infectious diseases. But SARS was, I think, the impetus to this. It made it happen, right? And made the contact tracing thing happen. And we're going to talk about an Ebola outbreak soon, or we're going to look at an Ebola. I think I got the Ebola article. Hold on. Yeah, an Ebola article from 2014 that talks about contact tracing. And you know what they didn't do? Apple didn't roll out an app. They didn't roll out an app then, right? So anyway, we're going to talk about Ebola and how they're using it there. But it seems like this contact tracing, which started in 2004, was workshopped through 2010. It requires public buy-in on a level that is not happening, and I'll show you that too. It seems folly to put this much money into a whole force of people whose job it is to contact trace and then isolate those people to prevent the spread of a disease that you may or may not get. But if you get told by these group of people you have to isolate in your house for 2 weeks, and it's for your own good, and don't you dare question it, you racist. You see what I'm saying? This is amazing poly territory all over this, and I don't have the vision, like I don't have the scope to see. I don't know what she does. She weaves years together much better than I can see it, right? Like I have to understand it so I can tell you. I know there's something here, and I think Amazing Polly should look at it, but I don't have the scope. I'd need to take like 4 or 5 days to really do it justice. And like, man, there's something here, and I think it's obvious, but I would love to have somebody back me up on that. I'd love to have somebody dig like Amazing Polly. Back to the article. Testing and contact tracing. Okay, yeah. Are considered essential to prevent the second wave of COVID-19 cases by identifying and isolating those infected by the disease and the people with whom they've come in contact. The second wave is the boogeyman, right? You don't want the second wave. The second wave comes, you're going to be infected. Oh no. Don't you remember those terrible videos out of China? Right? Okay. It's propaganda, right? And I mean, they can even point at the old folks' homes and say, oh, you don't want to infect somebody else, right? Even if you don't get too sick, you don't want to infect somebody else. But that's folly. The conversation doesn't have to be one or the other, right? Closed economy, or you're going to infect and kill grandma, right? Like that, and that's the options that they're trying to present to you as your only two options. Either we stay locked in our homes, or you're going to infect somebody else, or you're going to yourself die. Those are what they're trying to present to you, okay? And then they're selling this contact tracing as the cure-all. Don't worry, everyone, we're going to do this. But really, all they want to do is track you, right? Yeah. NBC News is saying Apple's iOS update is here, and it includes coronavirus contact tracing. Yeah, welcome to brave new world 1984, right? Like Big Brother lives in your pocket, and he's watching via camera everything you do, right? Like how terrifying would George or how terrifying would Mr. Orwell find this? I'm not Orwell, and I find this terrifying. Back to this. The PMO said all first ministers agreed they need to seamlessly coordinate testing and tracing as more Canadians begin emerging from home confinement. Rather, I scroll down a little bit. The PMO said Trudeau is signaling to the premiers that the federal government considers ramped up testing and contact tracing to be an urgent priority and is willing to give them whatever the help they need to make it happen. He's expected to emphasize that message today, that's today, May 22nd, at his daily update on the pandemic. Saskatchewan Premier Scott Moe, chairman of the Premier's Council, said Thursday the federal government can help provinces to conduct contact tracing of individuals who travel from province to province and those who arrive from outside the country once international travel begins to pick up again. So, and they're making it like I said last night. I was talking to Mark Friesen on a live stream, and I said last night, people are compartmentalizing things. It's not so bad because they're doing it for international travelers, right? And people who are arriving between provinces. So they're not going to track you because you're just going to work, right? You think that's where they're going to stop? Come on. You haven't been paying attention if that's what you think. Moving to a May 3rd article. So we read an article from the 22nd talking about how, as people emerge, this is an urgent priority, right? This is contact tracing, a key task as provinces reopen amid pandemic. And this is This stinks to me, right? This stinks to me. Okay, so I'm going to start mid-article because I want to make a point. British Columbia has one of the lowest rates of COVID-19 testing in the country, but is now expanding both testing and contact tracing in a bid to quickly catch and stop the spread of the coronavirus that causes the disease as physical distancing measures are eased. Are they eased? Are they eased out there? In BC, can you guys mention, is it eased out there? It's not eased in Ontario. Back to this. Details are expected to be announced this week about how those emergency measures will be lifted, and the province's health authorities have been preparing for new outbreaks that might result. And they talk about Alberta here. BC is now conducting about 2,500 COVID-19 tests daily, which led to dozens of confirmed cases every day. Every single confirmed case must be investigated, an often arduous process with public health officials working against the clock to retrace the infected patient's whereabouts and then find anyone who may have been exposed to the virus to ensure that they don't, in turn, spread COVID-19 to their contacts. Each case can have anywhere from a few in-home contacts to dozens. Public health alerts have been issued when tracking individuals in a public setting has proved impossible. So they say, if you were at the gym on Tuesday, you were exposed to COVID-19. We saw some of them in Toronto, right? Those are public health notices. Back to this, I scroll down. Public health. British Columbia has, since mid-April, opened up testing to anyone with COVID-19 symptoms, but the number of tests is still well below capacity. Each of the province's 5 regional health authorities is responsible for its own team, and services have expanded in those regions where COVID-19 cases have been highest. Fraser Health has bumped up its contact tracing team to a force of more than 200 people from 14. The teams are divided into specialized hubs to deal with different sectors, such as long-term care homes or factories. Vancouver Coastal had 7 nurses tasked to contact tracing before the pandemic. Now it has 12 teams or pods, each with 6 investigators. The pods are set up so that they can be divided and bolstered with new staff as needed. Vancouver Island Health has doubled its team, and Interior Health now has trained more than 100 public health nurses to do this work. Northern Health has a few cases, but has tapped other health officers, such as its tobacco enforcement officers, to help. Does that not... This terrifies me. No, just join the public health, and then we'll tell you who may have been infected, and you go tell them to stay home for 2 weeks. Because they might get sick. And if they don't get sick, that's great. We're really happy for them. But if they leave their house before the end of the 14 days, they're going to get this fine or this consequence or this. And who's to say who makes that list? Who makes that list? Apple's iOS update is here, and it includes coronavirus contact tracing. Isn't that great? You've been you don't even have to have public health come to your house anymore. They'll just buzz you on your phone. Don't go to work today. You've got 2 weeks in isolation. Hey. Right? Apple and Google on Wednesday released long-awaited smartphone technology to automatically notify people if they may have been exposed to the coronavirus. The company said 22 countries and several U.S. states are already planning to build voluntary phone apps using their software. It relies on Bluetooth wireless technology to detect when someone who downloaded the app has spent time near another app user who later tests positive for the virus. There are so many holes in this. People don't brush their teeth every day. Do you think that they're going to update Apple and Google app to say, yes, I've been infected with the coronavirus? They're going to have a problem with compliance. They're already having a problem with compliance. 4%, it says in the article here. I'm going to get to that in a minute. But fundamentally, people don't work that way, right? They just don't. And people will surrender the task of doing that, the task of updating Google and Apple about their virus status, right? Like they're gonna surrender that to public health, because public health and Google are gonna need to know, or public health and Apple are gonna need to know, and it'll be seamless, right? Right. This is a slippery, scary slope. Back to this. The company said they're not trying to replace contact tracing, a pillar of infection control that involves trained public health workers reaching out to people who may have been exposed to an infected person, but they say their automatic exposure notification system can augment the process and slow the spread of COVID-19 by virus carriers who are interacting with strangers and aren't yet showing symptoms. The identity of the app users will be protected by encryption and anonymous identifier beacons that change frequently. Quote, user adoption is key to success, and we believe that the strong privacy protections are also the best way to encourage the use of these apps, the company said in a joint statement Wednesday. The company said the new technology, the product of a rare partnership between rival tech giants, doesn't that make you wonder, right? It's like a cat chasing a horse. Solves some of the main technical challenges that governments have had in building Bluetooth-based apps. Maybe the government should hire people who can build Bluetooth-based apps. Right? Back to this. It will make it easier for iPhones and Android phones to detect each other, work across national and regional borders, and fix some of the problems that led previous apps to quickly drain the phone's battery. Scary, right? Don't worry, we'll solve all of your problems and everybody will have to use it because it's part of the operating system. Adoption, mass adoption like that, right? Just like the traffic data. Back to this. We invite other states. Okay. The statement on Wednesday also included remarks from state officials in North Dakota, Alabama, South Carolina, signaling they plan to use it. We invite other states to join us in leveraging smartphone technologies to strengthen existing contact tracing efforts, which are critical to getting communities and economies back up and running, said North Dakota Governor Doug Burgum. I think that's how you say that. A Republican. A Republican! That's so funny. Back to this. North Dakota has already launched a location tracking app that about 4% of state residents are using, higher than other U.S. states with similar apps, but fall short of the participation rate that experts say is needed to make such technology useful. Right. So I really think this is just getting the infrastructure in place, and then you get the users, right? You just get the infrastructure in place, you get the early adopters to test it out for you, and then you say, yeah, it's mandatory and it's connected to your health file. And if you don't have this, you can't enter any stores. Sorry. It's a slippery slope. And can they do it? I would have said a year ago, probably not. And now, oh yeah, you bet they could do it. And they could do it with glee, and the new health officers that they're hiring en masse will gleefully show up and do their jobs, right? Because they're probably well-paying jobs, $70,000 plus jobs, you know, show up on the door, tell them that they can't leave, and if they leave, they get a fine. And those jobs will pay for themselves, right? How many fines did they levy in the last couple of weeks? They're not going away. They're not going to surrender this. They've already decided. We're done. Like, the fines are there, and the municipalities need the money, right? Here's Ebola, and I just wanted to show you contact tracing is, I think I've made my point, but I've got this one, and I'm going to talk about it because I've got it here. So from 2014, Apple and Google did not roll out contact tracing in these places. They had to do it the old-fashioned way, and that's notable because we had the technology then. We could have done it then, and they didn't. There's a reason. How disease detectives are fighting Ebola spread, 2014. Okay, this is from nature.com. On 30 September, the U.S. Center for Disease Control and Prevention, CDC, confirmed the first case of Ebola to be diagnosed outside of Africa since the start of the current epidemic in Guinea, Sierra Leone, and Liberia. The patient is a man who flew to Dallas, Texas from Liberia after helping to transport a pregnant woman with Ebola to a hospital there. Now, Ebola is scary, right? But apparently Ebola is lousy compared to COVID-19, according to Dr. Tedros. Back to this. What is contact tracing? Once public health agencies detect someone infected or suspected of being infected with Ebola, they isolate that person. Public health workers then immediately start to trace every person in contact with the infected patient since his or her symptoms emerged. People with Ebola are only infectious after symptoms develop, and contracting the virus requires contact with sick person's bodily fluids such as blood or vomit. The public health workers monitor all contacts for 21 days, the maximum incubation period of the disease. If any contacts develop high fever or other symptoms of Ebola, they're isolated, and anyone they have been in contact with since developing symptoms is traced in turn. You see how exponential this could be? Right? And in this way, further spread can be stopped. Tracing of hundreds of contacts of 2 cases in Nigeria and Senegal, for example, has prevented them from sparking any outbreaks in these countries. So they're saying that this works. Okay, so in 2014, after 10 years of looking and doing studies and testing on models, they say that it does work. Is contact tracing difficult? And I'm going to start halfway through. Assessing the risk is easier said than done. The man diagnosed with Ebola in the United States had flown from Liberia to Dallas and was not showing symptoms when he landed on 20th September. He developed symptoms on 24th September and sought care at a Texas Health Presbyterian Hospital of Dallas on 26 September, but neither his symptoms nor the fact that he had just come from Liberia set off alarm bells. He was allowed to leave the hospital and was admitted to a hospital isolation ward on 28 September, meaning he could have infected others for 5 days. Now the CDC and Texas officials are tracing the man's contacts, a major undertaking akin to a door-to-door police investigation. The CDC has sent 10 outbreak response experts to assist local healthcare workers. They will need to identify anyone who spent time or shared living living space with the man in Dallas and anyone he might have had close contact with in places such as churches or restaurants. If contact tracing is so effective, why is Ebola out of control in West Africa? Hey, good question. Does it work, or are you just saying that it works because there's a whole bunch of jobs that are really well paying and very powerful? Back to this. Tracing an Ebola patient's contacts is much more difficult in countries that lack basic health and epidemiological infrastructure. Past Ebola outbreaks have also occurred in rural African villages where those infected tended to have few contacts, often concentrated in a small area. This made it relatively easy to identify people who may have been exposed to Ebola. The current outbreak has seen Ebola spread to dense urban areas where contact tracing is harder, as people there tend to come in contact with more people over a wider area. Contact tracing also becomes vastly more complex as the number of cases increases. Tracing the contacts of a single Dallas patient will require substantial effort, which gives a sense of the sheer manpower and effort that would be needed for effective contact tracing in West Africa, where Ebola cases number in the thousands. Now extrapolate to Toronto, or Vancouver, or Montreal, or just think of Canada generally. What does the infrastructure look like? What are they building right under our nose, with the enthusiastic support of the public? Because, it's for our safety, comrade, right? The last part. Can the method still be used in areas where Ebola is an epidemic? Yes, but only if international community can massively increase the number of trained health workers there. That was when the scam was send money abroad so we can just launder it. Now, the scam is keep us in our houses, under control, lock and key. I don't know what the scam is exactly, but it seems like there's a whole lot of people in on it. And it seems like there's not a lot of questioning about this contact tracing. How effective is it in stopping the spread of a virus? How effective is it in doing what they say it's going to do? How effective is it? Is it necessary for opening our economy? How can they respond to specific hotspots when right now we're still in Guelph in phase 1, when there doesn't seem to be a lot of danger of community spread? There's six cases. I'm not sure I understand what constitutes a hotspot for Justin Trudeau. What constitutes necessity of being in your house for 2 weeks? And who will have the authority to do that? Will it just be public health officers tasked with contact tracing? Hope you get one on who's having a good day. I don't know. There's something fishy here, and I've gone really long. The Ebola article I maybe could have cut. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Check out SpeakingMoistly.co. I'm going to have a new guest host next week as well, so that should be lots of fun. I'm looking forward to that. And I have a new intro song, and it's reggae. I can't wait. It's going to be lots of fun. Okay, thanks for watching. I already said that, and have a wonderful, wonderful day.